I was actually working that day when the computers went down.
One of the early memories of that right off the bat is, okay, so we can't access anything.
I remember the day it happened, walking through the emergency room, and there was a big billboard put up in the main campus emergency room with color-coded names and phone numbers.
And you literally start thinking of a doomsday scenario like you watch on Netflix.
We found out real quickly, those of us that have had the opportunity to be Epic, to be pre-computer, were able to kind of jump back into that a little bit quicker.
I've never done paper charts. I needed to learn how to navigate my patient care and transcribing what I'm doing for the patient into paper charts.
And I remember at that moment being like, okay, we can do this. There are processes already starting. There's problem solving happening. There's creativity. There's people coming together. We're just hours into this disaster.
The paper charting and folder system was up and running that day. It was amazing that everybody sprung to action and made the best of a situation that wasn't ideal and make that a more feasible situation than it otherwise could have been.
Communication is the biggest key piece to that. We figured out the processes from charting to what our capabilities were. Like anything, over the next couple of weeks, it got progressively easier and easier.
This was hard. When you speak of resilience, we think of strength, we think of courage, we think of bravery, and I think those are the things that we show on the outside.
Single-handedly, none of us could do this, but we have an incredible team that works together. So at the end of the day, they're going to put the patient first, and they're going to work through any problem that they have.
No matter how big the problem is, you're not facing it alone. It's a team effort to be able to face it, and it just becomes less of a challenge.
Epic Mobile is a software that is available for mobile devices.
It's been great in terms of being able to look up patients, looking up labs, looking up photos that were in the media section. It's really elevated the way we're able to deliver care now.
You can set labs to send an alert directly to your phone so that if there's something that you are concerned about and you want to get the information as soon as possible, the alert will actually come directly to you.
And it really, streamlines patient care, both for the provider on one end, whether it's the nursing staff or another physician.
Prior to Epic Mobile, and especially prior to Secure Chat, we would get a page, but being able to respond and keep a conversation going over that same thread was definitely difficult within that. Since we've had Epic Mobile, that has become much easier.
Ultimately, it's a win for the patient.
So I'll walk you through the process of how ambient experience has helped me. It's as simple as basically hitting record. Basically, you set it there on the counter, you forget that you're even using it, and you just start having your appointment and conversation with the patient.
The common struggle is between getting your notes done and making sure that you're documenting everything accurately.
This is not dictation. It's not just taking what you say and printing it off in verbal verbatim. It is formulating what your note is going to look like.
I've noticed a big difference in, especially after clinic hours, going back and completing documentation. It's cut down a lot on that.
Usually it takes about 45 seconds to a minute to generate the notes. Workflow is now, whether you're doing this between patients or after patient care.
The mental load of having a conversation that you had with the patient and then having to go back and summarize that in narrative form, all of that has been taken off of your shoulders.
It saves me 2 to 3 hours a week of free time. That is coming out of my free time. When I was writing notes, that's usually coming out of lunchtime, that's coming out of evening time, that's coming out of weekends. So the benefits in terms of my own personal life are huge.
We've never built something like this before at Kettering Health. We were challenged to create 24-hour access for the majority of our patients.
By creating 24-hour access, we've eliminated all sorts of steps that can slow down that process, because that patient has a concern, and so if they're concerned, we're concerned.
If your doctor tells you that you've got PVCs and you don't know what those are, you're going to worry about them. And so just knowing that you can get into a specialist very quickly can relieve a lot of anxiety.
We make that availability right away, next day, obviously, and then we channel the patient appropriately to the care that they need to get them more quickly to an answer and to definitive treatment.
So this is really a game changer for patient satisfaction.
Any cancer diagnosis is important, of course, but the majority of these cancers that we've diagnosed have actually been lung cancer. And those are cancers that you don't wait around on.
There have been many patients that said, oh, I was so worried and so anxious. I'm so glad I could get in the next day and get this taken care of.
This is sort of the maximum in patient centricity. This is trying to see what their experience is like, understand the anxiety that they have, and take away all the barriers. So we've been doing this for 2 months, and we've already diagnosed a number of cancers of patients who had the intuition, something about them that they knew wasn't right, and we got them in, and they've had diagnosis of cancer.
I think this has been a really worthwhile challenge, especially patients worrying about their heart. This can make a really big difference to help them alleviate the fear that they can get seen right away before something bad happens.